Everyone, so yes, am I audible? Is the screen clear so that we can start the session? Let me just check, and so we can quickly start the session now. Yeah, so today's session is of clinical anatomy MCQ series. Okay, okay, so we will start. Okay, let me start with the clinical anatomy MCQ sessions. Okay, everyone. So yes, yeah, dear, no, there was a session, but actually it's some technical issue. Don't worry, we'll take the session. Okay, I will just discuss. Let's start the session now. Before starting, so the students who have all joined, let me just start the session now. So am I audible? Is the screen clear so that we can start the session now? Okay, just checking for the sound and all. Yes, sir. So yes, few students. Okay, okay. VV associate Joseph. Okay. So yes, no, there was session dear, but actually due to some technical issues and all, the session is will be taken afterwards. Don't worry, I will give you the link of the session and also the whole. Yeah, okay, all the session link will be provided. Okay, so let's concentrate on this clinical anatomy MCQ series, and also tomorrow is Friday. So Friday I will take 50 MCQs, image based MCQs. So all those who have joined, let everybody join, and I will again announce this, that 50 clinical MCQs, not 50 images. Okay, that will be image based MCQs, so which I will take. So that is the target. So myself, Dr.Monalisa, I am an educator of anatomy subject on the platform of Unacademy, and I have done my MD anatomy from Armed Force Medical College, Pune. So what are the features of special classes? When I am talking about the special class, the features are, it's an interactive live session where the educators can interact with the students and aspirants, response to the poll. Polls are conducted and you can respond in the polls for a better interaction with the live educators. Participate in the poll. Also the students who want to follow the educator, they will get notification regarding all and every sessions. Lecture notes will be provided after completion of the session. PDF notes will be provided to you. Attend the session anywhere, anytime at your own place, and gain maximum benefits from the session. So actually, yeah, so there was free special classes, and for free special classes you have to use the code ANAT10 to unlock. So you can use this code ANAT10 to unlock the free sessions on the Unacademy platform. So tomorrow I have dedicated, so tomorrow is Friday, and tomorrow I have dedicated the sessions to YouTube. So 2 p.m. will be the session, and again I will take a session at 6 p.m. Tomorrow 2 sessions are there, one at 2 p.m. another at 6 p.m. So do join. 6 p.m. session will be 50 image based session, and 2 p.m. session will be anatomy quiz. So do join. I also want to tell you about the plus subscription of Unacademy, where you can access both live and recorded versions. So all 19 subjects can be assessed in a very schematic way. Learn from India's top educators, and you can compete in live tests and quizzes, study on the device of your choice, and assess more than 25,000 MCQs. Okay, so all these MCQs are made by the top educators of Unacademy platform, who is having more than 8 to 10 years of experience, and you will get printed notes provided with the Unacademy Plus subscription if you are taking the subscription of more than 1 year. Okay, I also want to tell about the iconic subscription, where the merging of both the Prep Ladder and Unacademy has been done. Clinical integrated essential session, video recorded lectures from the dream team of the Prep Ladder. QBank 3 can be accessed. Rapid revision snapshots and treasure dream notes 2021 is provided to you. So just grab this opportunity and take the iconic subscription. I also want to show you the comparison of the NEET PG plus subscription and that of iconic subscription. So whichever suits you, whether it is 18 months, 24 months or 36 months, go for it. Use this code for availing the opportunity of ANAT10 as my code, which will give you an additional 10% discount. What I suggest, students of the first and second year should go for iconic subscription targeting the next examination, and should go for 3 to 4 years of subscription. Students of final year and interns can take 1 year of subscription, and let's crack it together. So I also want to inform you about 25,000 and more clinical MCQs of all 19 subjects, includes a detailed explanation for each and every MCQs. Target NEET PG 22 batch. So what I want you to tell that NEET PG 22 batch and clinical discussion instrumentation batch. Okay, so for this, the 27th October is the date where the session has been started, and you can use this code. If you want to take the subscription, you can use the code NAD10 to get 10% discount. So just use this subscription for getting 10% discount and go for the subscription. If you are targeting the examination like INI-CET, next examination, go for Iconic subscription, and that too if you are in first or second year, go for 3 to 4 years of subscription. Final years and intern student can go for 1 and 1.5 year subscription. So let's start with the MCQ session now. Okay, those who have joined, all the best to everyone. Let's start with the session now. Okay, so let's start with the first MCQ. So this is a clinical MCQ session. So 10 MCQs, clinical MCQs of anatomy I am targeting. The first MCQ, let me read the MCQ for you. A 22-year-old girl comes to the office due to right ear pain. Okay, that pain has worsened over the past 2 months. The pain is dull, constant, and wax and veins. It worsens when she chew the food hard, like almonds and all. In addition to ear pain, her ear is also feeling stuffy and has got some ringing sensation. The patient grinds her teeth at the night and previously wore a dental guard, but it's broken several months ago. Ear examination is normal. Which of the following nerve, according to you, is most likely to be responsible for the patient ear pain? So we have got 4 options are there: glossopharyngeal nerve, hypoglossal nerve, trigeminal nerve, vestibulocochlear nerve. 4 options are there and you have to give me the right answer. So your time starts now. What I will tell to everyone that I will give you 30 seconds for marking the answer right and wrong. You write your answer in the message box, whichever you feel is the right answer. Write your answer and then I will come up with the explanation. So yes, what do you think is the correct answer? 9th cranial nerve, 12th trigeminal or vestibulocochlear? According to you, which is the right answer? So just waiting for your answers. So you can answer it and I will see this in my mobile messages. Okay, so yes, I got an answer. I am waiting for others to answer. Okay. So yes, most of the students are telling it's A. Okay, A, glossopharyngeal nerve, glossopharyngeal nerve. Okay, let me explain it. The correct answer is trigeminal nerve. The correct answer is C, that is trigeminal nerve. So let me explain why trigeminal nerve is the correct answer and why other options are not the correct answer. The reason why trigeminal nerve is the correct answer, the patient presentation, what you can see, the presentation of the pain is, the reason is TM joint disorder. See here. So what you can see that the pain is worsening when she chews hard food, almonds and all. Ear pain, stuffiness is appearing, ringing sensation. Also the patient grinds her teeth at the night. Actually and she has got a history of dental guard. So actually these are clinical scenarios which is presented here is pointing that the patient presentation is consistent with TM disorder. So all these presentations, so patient presentation or you can say clinical presentation of the patient is telling that the patient is having TM joint disorder. The patient is suffering from TM joint disorder. Okay. And there is hypersensitivity of, the patient is suffering with hypersensitivity of mandibular division of trigeminal nerve. Now, in addition to the trigeminal nerve innervating, actually what happened, trigeminal nerve is also innervating the ear canal. It is also important for the innervation of TM joints. Okay, so ear pain is referred because of the problem or the disorder the patient is having in the TM joint. So actually mandibular nerve, mandibular division of trigeminal nerve innervates external auditory canal Okay. And therefore TM joint disorder, the reason of TM joint disorder, actually all the surrounding muscles and all is getting innervation from mandibular nerve. There can be ear pain presentation in the patient due to referred pain. This is a case of referred pain from the lower jaw. The patient is having referred pain in the ear from the lower jaw. So this is a condition, and there is hypersensitivity. The patient is also explaining ear stiffness related to the reason of ear stiffness, and all these conditions are related to hypersensitivity of the tensor tympani muscle. So the patient is also complaining of tinnitus. Also, actually what happens, it is lying very close to the proximity of the muscles of mastication, and there is connection of TM joint, there is connection of disorders of TM joint with that of areas of hearing. So because of this, the patient is having a clinical history of involvement of TM temporomandibular joint, and the referred pain is occurring in the ear. So see here, what you can see in this diagram, this is the trigeminal nerve, and you can see mandibular division of trigeminal nerve is innervating the lower aspect of the mandible, and it is giving innervation to the area around TM joint. Mandibular nerve supplies, it is giving innervation to TM joints, and it is also giving innervation to floor of mouth. Okay, it is also giving innervation to anterior tongue and lower part of face. So there can be the transmission or referred pain in this case via trigeminal nerve. Okay. So also you can get confused with the other options provided. So let me explain the other options also. So we have consistent with the history of the patient is of TM joint. So I am marking C as the correct answer. The reason of other nerves is being incorrect, because if we talk about the glossopharyngeal nerve, basically glossopharyngeal nerve is providing sensory division. The sensory component of glossopharyngeal nerve is providing innervation to that of middle ear, pharynx, tonsil, and that of posterior 1/3 of the tongue. Okay, these are the sensory component of the glossopharyngeal nerve, providing innervation, general innervation to that of providing general innervation to that of general innervation to that of posterior part of the tongue, also taste sensation of posterior part of the tongue, tonsil general innervation, pharynx and middle ear. So here the history is of involvement of TM joint surrounding structure, and so this is the reason glossopharyngeal nerve is not the correct answer. Okay, so it is controlling general sensation from carotid body, carotid sinus. So here the sensory involvement is not there, also the involving the muscles of TM joint. So this is not the correct answer. Hypoglossal nerve is also not the correct answer, because it is giving motor innervation, but it is giving motor innervation to that of intrinsic and extrinsic muscles of the tongue. Intrinsic and extrinsic muscles of the tongue. So this is the reason that B option is not correct. Okay. Okay. Vestibulocochlear nerve is not the correct answer. Actually, it is providing special sensory innervation. Vestibulocochlear nerve is providing special sensory innervation which is required for the auditory and balance. It is maintaining auditory sensation, balance of the inner ear. So this is not involved. So this is not the correct answer. So in this case, the history of the patient of involvement of TM joint disorder and referred pain to ear marks C as the correct answer. So is it okay everyone? Please let me know. Mafiz and everyone, Joseph, is it correct? Can we move on to the next one? Can we move on to next one, MCQ number 2nd? Just let me know everyone, so we can move on to the second MCQ. Okay, so let's move on to the second MCQ. Question number 2nd. Okay, okay, great, all the best. So a 16-year, so yes, a 16-year, yeah. So a 16-year, yes, a 16-year-old boy is brought to the clinician with a complaint of severe lower abdominal pain which is followed by vomiting. Okay, with biliary pigment. So actually you have to note down all the clinical and the key points which is mentioned here. यहाँ पे what is the key point mentioned? Severe lower abdominal pain the patient is having. Also the patient is complaining of the vomiting, as you can see here, with the vomiting is consist of biliary pigments also. So there is no alteration in the bowel habit or pain did not radiate. So there is no history of pain being radiating. The patient is tachycardic and has got shortness of breath. Radiological examination do not show such gas clouds in the peritoneum. So there is absence. So see here, radiological examination is not showing any gaseous clouds in the peritoneum. So after more examination being done, the clinician diagnosed the boy is suffering from posterior duodenal ulcer. So please mark the location of duodenal ulcer, my dear aspirant. It's the posterior duodenal ulcer. Posterior duodenal ulcer. So which structure is majorly damaged in this clinical condition? Okay, so you can give me the answer whether it is A, that is peritoneum around the proximal duodenum, whether it is B, inferior pancreatico-duodenal artery, that is the branch of inferior mesenteric artery. Okay, then we have got posterior superior pancreatico-duodenal artery, which is a branch of gastroduodenal artery, right gastroepiploic artery, branch of gastroduodenal artery. So my dear aspirants, we have got 4 options and you have to tell me which is the best correct answer for this MCQ. 4 options. All the best to everyone. All the best to everyone. Okay, so 30 seconds will be given to you. Okay, so I am getting an answer as Joseph. Okay, so everyone try to give the answer. Whether it is correct or not, that is not mattering. What matters for me is participation, and if we make any wrong also, then I am here to rectify it. So don't worry, we will discuss all the correct option and also the incorrect option. So don't worry about this. Okay, all the best to everyone. So according to you, in this clinical scenario, what is the most correct answer according to you? Okay, yeah. So yes, mixed bundle of answers are coming up. Different views are coming up for everyone. Okay, different views are coming up with the students. So let me give the correct answer here. So yes, now I will tell the correct answer is actually C, that is the posterior superior pancreatico-duodenal artery, branch of gastroduodenal artery. So according to me, the most correct option is C. Now let me prove it. Okay, मैं क्या बोल रही हूँ, what I am telling, मेरा क्या आंसर है, posterior superior pancreatico-duodenal artery. आपका क्या डाउट होना चाहिए मैम, why? Your question must be why. So let me prove it. Okay, so I got Mafiz is also telling the same answer. He is also telling C is the correct answer. Okay, let me come to the correct answer. Actually, when I am talking about the superior pancreatico-duodenal artery, that is also specifically posterior. So my dear aspirants, यहाँ पे after the examination, the clinician has diagnosed the boy is suffering from posterior duodenal ulcer. The boy is suffering from posterior duodenal ulcer. So we got the correct answer, that is posterior duodenal ulcer is involved. So this is how, and my dear students, actually N, what happened? N, okay, Mafiz, what you are telling, I am just slightly confused. Okay, actually posterior superior pancreatico-duodenal artery, which is a branch of gastroduodenal artery, it is giving blood supply to pancreas and it is giving blood supply to the posterior superior part of the duodenum. Okay, posterior superior part of the duodenum. So according to me, this is the correct answer. So let me just write my answers here. So yes, according to me, the correct answer is posterior pancreatico-duodenal artery, and the reason is posterior pancreatico-duodenal artery is basically giving blood supply to the head of pancreas, and yes, B option, yeah Mafiz, you are absolutely right. I am coming to incorrect options also, don't worry about it. I will come to incorrect option also. Firstly, let me prove the correct option. Yeah, so yes, Mafiz has given the right answer also. he has ruled out the B option. Why it is incorrect? Yes, that it is absolutely incorrect, because we clearly know, you are absolutely right dear. Inferior pancreatico-duodenal artery, we know that it is a branch of SMA, superior mesenteric artery, given at the level of L1. It is not a branch of inferior mesenteric artery. Inferior pancreatico-duodenal artery is a branch of superior mesenteric artery, not a branch of inferior mesenteric artery. So it can't be the correct answer. So absolutely right. Head of pancreas and upper border of superior part of duodenum. Actually superior part and also descending part of duodenum, descending part. So one of the clue is that posterior part of the duodenal ulcer is there. So it is the correct answer. Okay, and it supplies most of the antero, so it is giving, actually superior pancreatico-duodenal artery is giving, is giving anterior and posterior branches, which is giving blood supply to antero-superior aspect of the duodenum. That is exactly the area near head of pancreas and the superior border, superior aspect of the duodenum, and descending part, initial descending part also. So I am in the favor of C. Why B is not the correct answer is already explained, because it is written wrong that inferior pancreatico-duodenal artery is a branch of superior mesenteric artery, not of inferior mesenteric artery. So yes, this is the wrong option. Peritoneum around the proximal duodenum. Why it is wrong, I will tell you when I am talking about the peritoneum. Okay. So actually in this case, if you read the MCQ nicely, there was mentioned that there is no gas clouds. There is no gas clouds in the subdiaphragmatic part. If you remember the MCQ nicely, वहाँ पे एक word mentioned था, there is no gas clouds in the subdiaphragmatic region. Subdiaphragmatic region में कोई gas clouds नहीं है. There is no gas clouds, so there is no damage to peritoneum. This proves there is no damage to peritoneum. No damage to peritoneum. That means A option is not correct. Everyone, is it okay? That means A option is not correct. Yes. Yes. So we have got A and B as the wrong. Right gastroepiploic artery. When I am talking about right gastroepiploic artery, which is a branch of the gastroduodenal artery, it is not the correct answer. Actually, it is giving basically blood to the greater curvature of stomach. It gives blood to the greater curvature of the stomach, and it is not involved when the posterior part of duodenal ulcer is the location. So it can't be the correct answer. So by this, by ruling out the incorrect option, we get the most correct answer as C. So all of you, is it okay? Give me a thumbs up if you have understood this and you are marking C as the correct answer. I have ruled out all other option, and by ruling out or striking out the incorrect option, we get C as the correct answer. Most correct is the C. So can we move on to the next MCQ, everyone? Give me a thumbs up so that I can move to question number 3rd. Okay, so let's move on to question number 3rd. Yes, a 63-year-old man is admitted to the hospital after suffering a cerebral infarction. A shallow study performed during acute recovery period shows oropharyngeal dysphagia. The patient is having oropharyngeal dysphagia. Despite being maintained on the appropriate dietary restrictions, the patient experiences episodes of vomiting while lying on his back and subsequently develops pneumonia. So what is the position of the patient? Patient experiences episodes of vomiting while lying on back, means supine position. What does this mean? This is the clue that the patient is in supine position. So which of the following region is most likely to be affected? Anterior segment of left upper lobe, basilar segment of right lower lobe, posterior segment of right upper lobe, lingular segment of left lung. So according to you, my dear aspirants, which is the correct answer? 30 seconds for you, and then I will come up with the answer. 30 seconds is given to the students. Okay, so please mark the correct answer. Whichever you feel is the most correct answer, please mark it correct, and then I will come up with the explanation. Shallow study shows oropharyngeal dysphagia. Patient is in the supine position, okay, and likely on the back subsequently develops pneumonia to which. So yes, I got Shahil is telling it's B. So Sahil has given the answer B. What about others? Mafez also B. So let everyone give the answer and then I will come up with the explanation. According to you, which is the correct answer? Question number 4. Question number 3rd. So my dear aspirant, the correct answer is posterior segment of right upper lobe. So yes, B option is quite confusing. You can feel that B option is also the right option, but if I have to pick the one which is correct in this scenario, I will go with C option, and I will give you the correct explanation also why I feel C is the most correct. You can get confused with the B also, but the most correct answer is C, because the position of the patient is supine position. Lying down position means supine position. Got it? Let's come on to the explanation. So my dear aspirant, the correct answer is the involvement of posterior segment of the upper lobe. So why posterior? So in this case, the correct answer is posterior segment of right upper lobe. Now the reason of right upper lobe being involved is that due to gravity. What happens due to gravity? Okay, so the reason is due to gravity, there is typically developing the pneumonia develops in the most dependent part of the lung. So one reason is that due to gravity, the pneumonia typically develops in most dependent position of lung, in most dependent position of the lung. So due to gravity, pneumonia has to be developed in the most dependent position of the lung. Okay, Vedan, welcome to the session, Vedan. Okay, so and the patient who aspirates in supine position. So when the patient is aspirating something in the supine position, it is going to involve the posterior segment of upper lobe. So please mark it as for your learning, and very important, many MCQs has been targeted from this point. All of you please mark this point. The patient who aspirates in supine position. This was mentioned in the MCQ that the patient was in supine position. So whenever the patient is in supine position, the most important involvement of the segment is posterior segment, is the posterior segment of right upper lobe. So your doubt may be why right upper lobe. So my dear aspirants, actually there is the right upper lobe, and sometimes what happens also, the involvement will be superior segment of lower lobe. So right side इसलिए involved होता है because trachea is more vertical, more wider in the right hand side as compared to the left trachea, left bifurcation of bronchus of the trachea. So right hand side, and the most important site of involvement is posterior segment of right lobe. One more segment can be involved, and the other segment which can be involved is superior segment of lower lobe. So this is most important, and the other segment which can be involved is superior segment of lower lobe. So two more segments are involved. One is the posterior segment of right upper lobe, which was given in the option. So I have marked this as the correct answer. The second is superior segment of the lower lobe. Superior segment of lower lobe. Yes. Now, okay, now yes, we have done with this. Now, in addition, so this was the explanation when the patient is supine, and your doubt can be, ma'am, when the patient is in recumbent position or the patient is in prone position. So when the patient is in prone position or recumbent position, the aspiration, as we know, one point is absolutely clear, that the aspiration is always being more on the right hand side as compared to the left bronchus, because right bronchus is more wider, shorter and more vertical. What is the reason? Foreign structures can accumulate onto the right hand side because trachea is more wider, more vertical, and more shorter in right hand side, and this is the reason that it is generally involving the right hand side. And a mnemonic is there. How you are going to remember this? Just shallow a bite goes down right. So what is the mnemonic? Everyone, how you are remembering that right hand side lobes are involved? Shallow a bite goes right down. Okay, shallow a bite goes down right. Shallow a bite and it goes down right. Okay, so this is the mnemonic. So I will write that mnemonic also. When the patient is in the prone position due to gravity, and what happens when it is in slight upright position, it will lead to involvement of basilar segments. Few of the students has given the answer basilar segment. They are also correct, but the position should be upright, or the position should be upright. Okay, the patient should be in upright position, prone position, then the basilar segment is involved. In that case, basilar segment of the lower lobe is involved. Got it? So yes, this is the correct answer, and here you can just remember the mnemonic is shallow a bite goes down right. Shallow a bite goes down right. This is the mnemonic. Okay, all of you, let's move on to question number 4th. So is it okay? Have you understood? Can we move on to question number 4th? Everyone, please give me a thumbs up if you have understood. Let's move on to question number 4th. Okay, so I will read the MCQ for you. All the best for it. A patient has been severely injured in the back of the head during a mugging attempt, and the imaging study reveals possible fracture of the skull along with the C1 atlas vertebra. Which atlas vertebra is involved? Please mark it. It's the first cervical vertebra, atlas vertebra. Okay. The patient is also having hemorrhages from the vertebral artery in this location. The attending surgeon will attempt to stop the bleeding through occipital, suboccipital triangle, which is the region which has to be approached, suboccipital triangle. Which of the following muscle attaches to the transverse process of C1 to the occipital bone, forming the lateral border of the suboccipital triangle? Okay, so your time starts now. Please mark the correct answer, whether it is obliquus capitis superior, inferior, rectus capitis posterior, or rectus capitis minor. The hint is already provided in the MCQ. So waiting for your answer. Mark the correct answer. Joseph have given the answer. What about others? Okay. Okay, let me come up with the correct answer. The correct answer is, so yes, I got Rangaraj has also given the answer. Okay, the correct answer is question number 4. The correct answer is B, obliquus capitis superior. Obliquus capitis superior is the correct answer. That is B, because the structure which is attached to the transverse process of C1 and also forming the lateral border of suboccipital triangle is the obliquus capitis superior. Okay, obliquus capitis inferior is not the correct answer because it is forming inferior border. Rectus capitis posterior major is not the correct answer because it is forming supromedial border. Rectus capitis minor will lie along with the rectus capitis posterior major muscle, supromedial border. Okay, so let me slightly highlight this diagram. What you can see here, I am showing you this diagram where you can see the obliquus capitis superior muscle attachment. So when I am talking about obliquus capitis superior, this obliquus capitis superior muscle is attached to atlas transverse vertebra. What is this? This is the transverse vertebra of atlas. This is the transverse. See here, if I highlight this diagram, what you can appreciate, this is the transverse. This is the transverse border of the, this is the transverse process of atlas. So obliquus capitis superior muscle is attached to transverse process of C1 cervical vertebrae, and also it attaches to the area between the nuchal line. So here this is the superior nuchal line, here will be the inferior. So it attaches to the occipital bone between the nuchal lines superiorly, between the nuchal lines, superior inferior nuchal lines. Okay, and also we know that this obliquus superior muscle, obliquus capitis superior muscle is forming superolateral border of suboccipital triangle, suboccipital triangle. So all these things proves that this is the correct answer. Now what about the other option? And let me just show you this diagram where you can see the boundaries, where you can see the boundaries of suboccipital triangle. So this diagram is showing you suboccipital triangle boundaries. In the MCQ it is clearly mentioned that you have to mark the lateral one. So yes. So let me just highlight this image slightly. And I would like to give you the details. Yeah. So here what happens when I am talking about rectus capitis posterior major muscle, rectus capitis posterior major muscle, this can't be the right answer because this rectus capitis posterior major muscle is forming supromedial border for the suboccipital triangle. Got it? And it is attached to the spinous process. Can you see here in the diagram? This is the first cervical vertebra, C1. This is C2. So it is attached to the spine of C2. It is attached to the spine of second cervical vertebra. So this can't be the right answer. So this is wrong option. Okay. The other option was rectus capitis posterior minor. So it can't be the right answer because it is lying very close. So it is also contributing to supromedial border only, it is supplementing the supromedial border. So it can't be the right answer. So this option is also wrong. And it is attached to inferior nuchal line. It is attached to the nuchal line. Got it? Now obliquus capitis inferior muscle can't be the right answer because it is forming inferior border. As you can see the diagram, it is forming the inferior border of suboccipital region. This is inferior border. And clearly in this diagram you can see the lateral border is formed by, suprolateral border is formed by obliquus capitis superior muscle. So this is suprolateral border. So this is the right answer. Yes, yes Joseph, you are absolutely right. The roof is covered by semispinalis capitis. Absolutely right Joseph. So this explanation proves that option obliquus capitis superior muscle is the right answer. Yes, semispinalis and all is forming the roof structure. So it will not contribute. Yes, semispinalis was also given as the option not. So that is forming the roof structure. So can we move on to the next MCQ? Everyone, can we move on to the next, that is question number 5th. Everyone give me a thumbs up so that I can move on to the next MCQ, that is MCQ number 5th. Okay, question number 5th. A 42-year-old man with an automobile accident suffered severe pelvic trauma. The bulb of the penis and the urethra were torn from inferior surface of urogenital diaphragm. Okay, so what happens? The bulb of the penis and urethra were torn from inferior surface of urogenital diaphragm, and the urine was extravasated from the urethra. So you just tell me on which reason the urine will accumulate, whether it is deep perineal space, whether it is ischioanal space, whether it is retroperitoneal space or superficial perineal space. According to you, which is the correct answer? Question number 5th, mark the correct answer. We have got 4 options and you have to give me the correct answer. According to you, which is the correct answer? Question number 5th. Your time starts now. All of you, please mark the correct answer. And I also want to tell that tomorrow there will be one session at 2 p.m. which is MCQ marathon session for for solving the MCQs there, that will be of 15 MCQs, and again 6 p.m. session 50 image based MCQ. All of you do present live for that session, 50 image based MCQs. So that will be a session of minimum 3 hours. So okay, take proper rest, eat properly and be present for that session. Tomorrow is a session where I am taking 50 images session, 6 p.m. is the timing, and the another session 2 p.m. in the afternoon. So yes, we have got mixed bundle of answers are coming up. Okay, so yes, let me just see which is the correct one. So yes, I got an answer D. Okay, so students are telling A and D, A and D. So my dear aspirant, the correct answer is D. So D is absolutely correct answer, that is superficial perineal space. The location, so what is the location? The location of rupture is the bulb of penis. So bulbar urethra will be torn, and we know that bulbar urethra if torn, which is lying below urogenital diaphragm, the accumulation of the urine will be in superficial perineal space. It can ascend up till the level of anterior abdominal wall also. So see here. So all the other spaces, can you see, deep perineal space, ischioanal space and retroperitoneal space, all these space can't be the right answer, because these spaces are shut down from any communication with the superficial perineal space by attachment of modifications of deep fascia. So actually the modifications of deep fascia is tightly closing the other spaces which is mentioned in this MCQ. The space which will be involved is superficial perianal space. Bulbar urethra, the blood, the urine blood will accumulate in the superficial perineal space. So this is the diagram where you can see this is showing the rupture of urethra, the bulbar urethra. What you are seeing, the rupture of urethra. In which part is the rupture of urethra? The rupture of urethra is in the bulbar urethra, bulb of penis, which is lying below the location of urogenital diaphragm. So here will be the location of urogenital diaphragm somewhere here. So this will be UGD, that is urogenital diaphragm, which contains the membranous part of urethra. Below to it, in between the Colles fascia and also over the dartos muscle, going over the Buck's fascia, and ultimately extravasation in the superficial inguinal space, going in the above direction towards anterior abdominal wall. Yes, let's move on to the next MCQ, that is MCQ number 6th. A patient arrives in the emergency room after having suffered severe head trauma in a motorcycle accident. A radiographic study of the head reveals a basilar skull fracture in the region of foramen ovale. Which of the following functional losses could most likely be related to this injury? Option A, loss of abduction of eye, loss of sensation over the forehead, loss of sensation over the zygoma, paralysis of anterior belly of digastric muscle. So question number 6, mark the correct answer. The key points which is mentioned here is head trauma, basilar fracture of the skull, basilar fracture of the skull in the region of foramen ovale. This is the key point. Fracture of the skull in the region of foramen ovale. Which of the following loss is likely to happen in this case? Question number 6, mark the correct answer. So yes, I am getting D as the correct answer from few of the students. What about others? What about others? Which is the correct answer? Okay, D. So most of you are absolutely right. Yes, all of you are absolutely right. The correct answer is paralysis of anterior belly of digastric. Actually, why? This is a clinical scenario MCQ, but the location is already provided here, and the location is absolutely right, all of you. The location is foramen ovale. The location is foramen ovale, my dear aspirants, and we know that foramen ovale will have which structures traverses through foramen ovale? All of you exactly know the structures traversing is male. Male. So all of you please write your answer. What does M stands for? What does M stands for? M stands for mandibular nerve. A stands for accessory middle meningeal artery. L for lesser petrosal nerve. N for emissary vein. Got it? So yes. So all of you do remember the structures traversing through ovale is male. This is the structures traversing through foramen ovale. Here the loss of abduction. Abduction is caused by abduction of I lateral rectus muscle. So that is LR6, abduction. So that can be the right answer. So actually sensation of forehead, ophthalmic division of trigeminal, that can be also not the right answer. Sensation of zygomatic bone, that is the maxillary division of trigeminal nerve. Maxillary division of trigeminal nerve. Yes, loss of abduction is not the right answer because in that case abduction may lateral rectus is involved and that is getting in a LR6, abducen nerve. So this is not the correct answer. Loss of sensation of forehead, not the right answer, and the reason is ophthalmic division. V1, ophthalmic division of trigeminal nerve. Loss of sensation over the zygomatic bone, maxillary, V2. So the correct answer is anterior belly of digastric. So all of you clearly know anterior belly of digastric is getting innervation from which nerve? Mandibular nerve. Anterior belly of digastric is getting innervation from mandibular nerve. So this is the reason D option is correct. Okay. Where it is located, foramen of ovale is located in greater wing of sphenoid bone. It is located in greater wing of sphenoid bone. Done. Let's move. All the best. Let's move on to question number 7. 4 more MCQs. This the okay. So question number 7 is 17-year-old student. Yes, it's a muscle of first arch. Absolutely right. Muscles of mastication, anterior belly of digastric, tensor tympani, tensor villi palatini, all these are the muscles of first arch. Yes, absolutely right dear. A 17-year-old student is brought to the emergency room displaying vomiting, fever, diarrhea. The patient reports that for a period of 24 hours prior to the admission, he suffered from abdominal pain first centered around the navel and then moving inferiorly to the right. As the patient talks, you realize that he is the gesture towards the McBurney's point. You tentatively diagnose it is a case of acute appendicitis. So with this clinical aspect, that is the sensation or the pain towards the McBurney's point, the clinician or the surgeon is knowing that it's a case of emergency, it's a case of appendicitis and emergency surgery is required. So accurate visualization of appendix during the surgery can be verified by which of the following landmark? What are the landmarks provided in this MCQ? Bifurcation of abdominal aorta, epiploic appendices, hostration and tinea coli. Bifurcation of abdominal aorta, epiploic appendages, hostration and tinea coli. 4 options are there and you have to give me the right answer. Question number 7. Mark the correct answer. Question number 7. Okay, B. So one of the, okay. Okay, so yes. What about others? What about others? What according to is the correct answer? Okay, D. So yes, I am getting B and D as coming as the answer. Let me tell which is the right one. So which is a guide for the surgeon to locate appendix during the surgery. So yes, I got a mixed answer. I am getting a mixed bundle of answers. What about others? The correct answer here is, my dear aspirants, the correct answer here is D, that is tinea coli. D, that is tinea coli. So actually tinea coli, what do you mean by? Tinea coli is the fold which is longitudinal muscle coat. Okay, so let me show you this diagram. Here you can see this band which you are seeing here, this band, this is called as tinea coli. Okay, this is a longitudinal muscle coat which is forming the tinea coli. So this is tinea coli as shown in this diagram. Okay, so actually it's a, we have got three longitudinal muscle coat of smooth muscle band. These are smooth muscle band. Yes, runs over the hostration. Yeah, so it's a smooth, tinea coli are smooth muscle band which is all running along the length of the colon. So this is running along the length of colon, and actually these are all converging. Yes, Prachi Roy, you are right. These are running and these are all converging over the base of appendix. Can you see here that tinea is converging at the location of base of appendix? So this is an important landmark for locating the location of appendix. Okay, so as it is a part of appendix is also a part of colon, so it becomes an important criteria for locating the location of appendix. Yes, absolutely right. Yes, it is the location where the base of the, so in this diagram also, yes, Mafiz, the tinea coli are onto the cecum where the base of appendix is attached. So that is approximately, that is absolutely right, and you can see here also close to the base of appendix the tinea coli is converging. So this is an important landmark for the location. Now what are the other options provided? The other option was, so let me tell you about the other option. So bifurcation of abdominal aorta is not the right answer. Actually bifurcation abdominal aorta can't be the right answer. It's a retroperitoneal structure. It's a retroperitoneal structure. So how can it help us to locate the appendix? So it can't be, we can't be able to locate the appendix by the location of bifurcation of abdominal aorta. Hostration is also not the right answer because hostration is an important point. Actually the contraction when we are talking, so hostration is also called as sacculations. Hostration is also called as sacculations and it is formed by the contraction of teneas. The reason of formation of hostration is contraction of teneas, and they are contracting to lead to the formation of hostration. So this is again not the right answer for locating the appendix. It can be, it is not for appendix. Hostration is not found in appendix. Okay, so this is also wrong. So we have got A also wrong, C also. Why epiploic appendages is not the right answer? It is also not. Actually epiploic appendages are small fat bags. They are small fat peritoneal bags, which is also not a feature for identification of appendix. It's a feature for colon. So see here, you can see here these are the features of colon which is seen. If you can see fat filled peritoneal sacs are there. These are all seen in the case of colon. Hostration is also important for locating colon. Tinea coli, which is the third important cardinal feature of large intestine, but it is converging towards the base of appendix. So we will take tinea coli as the correct answer. So this is the reason we will move on with the most correct answer. If we have to choose, we will go with tinea coli. Is it okay everyone? Is it okay everyone? Let me know. Yeah. Okay, got it everyone. Can we move on to the next MCQ? So let's move on to the next MCQ, that is MCQ number 8. A otherwise healthy student. Okay dear, thank you. A otherwise healthy student taking no medicine is concerned because he has noticed several painless, uniform, large, mulai, okay, Vedan, large bumps at the back of the tongue. So what is the most likely the case? Question number 8, mark the correct answer. So question number 8, mark the correct answer. A person who is very healthy, has no medications taken, have got painless, uniform, large bump at the back of the tongue. So yes, according to you, which is the most correct answer? Question number 8. Okay, so I am getting Mountain Life is telling it's C, Mulay is telling, Vedan is telling A. What about others, so that I can move up with the explanation? So yes, C. So C and A. Okay. So let me give the explanation for this MCQ. Large bumps at the back of the tongue. So if I have to choose one correct answer, I will go up with C only. Why? The reason is that circumvallate, so when we are talking about circumvallate papillae, it is large bump. So it appears like a large bump which is located at the posterior part of the tongue. It is located at the posterior part of tongue. Yes. Yes. So yes, large bump at the posterior. Okay, Prachi Roy. So these are large bump at the posterior part of the tongue, which is called as circumvallate papillae. So, and as you can see, the patient is having no history of medications. The patient is perfectly alright with no history of medication, painless. The bumps are painless. So these are the reasons that the circumvallate papilla is the right answer. Now, sorry, filiform papilla is not the right answer, and the reason is that filiform papilla is not the right answer. The reason for it being not, it is covered on whole surface, whole dorsum aspect of the tongue. It is a very small papilla which is covering whole of the dorsum aspect of the tongue, and actually it is giving, it is, so when we are talking about filiform papillae, the rough texture is given to the tongue by the filiform papillae. The reason is that filiform papillae is giving rough texture to the tongue, so it can't be the right answer. Can you tell me this filiform papillae is having which type of lining epithelium? So this is an MCQ to everyone. Filiform papillae, yes, you are right, it is not having any taste bud, filiform papillae. My MCQ is that what is the lining epithelium of filiform papillae? What is the lining epithelium of filiform papillae? And that is the reason it is giving rough texture to the tongue. My question is, what is the lining epithelium? Lining epithelium of filiform papillae. So what is your answer? This MCQ is for everyone. This is also an MCQ, lining epithelium of filiform papillae. According to you, which is the right answer? Anyone wants to give the answer? Actually, when I talk about the entire tongue, the lining epithelium is stratified squamous non-keratinized. So all of you please note down the lining. When I am talking about lining epithelium of filiform papillae, it is stratified keratinized epithelium. It is stratified keratinized epithelium. It's not non-keratinized, it is having keratinization. That is the reason stratified squamous keratinized. Yes, it is stratified squamous keratinized epithelium, and that is the reason it is giving rough texture to that of the tongue. So, okay, and in between filiform, we have got the fungiform papillae. Okay, aphthous ulcers and candida colonies are not the right answer. The reason is that aphthous ulcers, when I am talking about aphthous ulcers, so for here, when I am talking about aphthous ulcer, it is actually this ulcer will be small white red mouth lined structures, and this is actually candida colonies. These are seen in the patient of immunocompromised patients. They are seen in immunocompromised patients, those who have got an history of drug medication or drugs being used. So such an history was not provided in the patient. The patient is perfectly alright, not an immunocompromised patient, not suffering from any kind of illness or not taking any kind of medications, any kind of antibacterial or immunocompromised patient ki history nahi hai. So we will go with C as the correct answer. So this is the reason we will pick C as the correct answer. Now my dear aspirants, I want you to show this diagram where you can appreciate the location of circumvallate papillae. So this is sulcus terminalis. Okay, This is sulcus terminalis, which is dividing the tongue into, this part is whole the posterior part. So this whole part is the posterior part of the tongue. And this will be the anterior part of the tongue. So this is dividing, this is the anterior 2/3 part of the tongue, and this is the posterior 1/3 part of the tongue. And in the posterior part of the tongue, you can see so much of elevations and roughness, and many lymphatic follicles are there. This is forming lingual tonsil. Posterior to it lies the epiglottis, the laryngeal cartilage. This big bumps which you are seeing, this bigger size bumps which you are seeing, is the valid papilla, that is circumvallate papilla. So that is the reason circumvallate papilla is the right answer. And whole of the surfaces having filiform papilla, in between also fungiform papilla. So exact location exactly is lying anterior to sulcus terminalis bumps, that is circumvallate papilla. So this is the reason circumvallate papillae will be the right answer. Okay, so let's move on to the next MCQ, that is MCQ number 9th. Okay, we know in adults that lack of vitamin D give rise to diseases like osteomalacia. This osteomalacia is characterized by progressive softening and bending of the bones. What is the key feature? What is the clinical presentation? It is characterized by progressive softening and bending of the bones. This is due to a defect. The reason of this case is defect in mineralization of the osteoid. So please note down, there is defect in the mineralization of the osteoid. There is defect in mineralization of osteoid. Under normal condition, the osteoid is found along which of the following condition? So which is the exact location where the osteoid is formed? A, in between the osteocytes and the bones, interface between the osteoprogenitor cell and the bone marrow, interface between the fibroblast in the periosteum, interface between the osteoblast and the bone. According to you, which is the correct answer? So yes, 4 options are there, A, B, C and D. You have to pick the most correct one. So your time starts now. Mark the correct answer. Question number 9. Okay, so yes, Mountain Life is telling A, between osteocytes and the bone. What about others? Mixed bundle of answers are coming up. Anyone else wants to give the answer? A with a question mark. Mafiz is telling A, but he is marking as it is a question mark. So actually, let me come up with the explanation. So yes, Joseph is telling it's D. Okay. So yes, my dear aspirants, the correct answer is D. Absolutely right. It is the location. So D is absolutely correct answer. It is exactly located between the osteoblast and the bone. Interface between the osteoblast and the bone. So first thing is that, what is osteoid? Osteoid means unmineralized organic matrix of the bone. What do you mean by the word osteoid? The word osteoid means unmineralized organic matrix of the bone. And this osteoid is produced by, can anybody tell me the answer? This osteoid is produced by or formed by osteoblast, and it is formed by osteoblast and lies in relation between the osteoblast and that of osteoblast cells and that of bone. So this is the exact location. It is located between the osteoblast and that of osteoblast cells and that of bone. So if we have to choose one, we will go with this as the correct answer, that I think D was given as the correct answer. Okay. So osteocyte is not included as to be in the correct answer. Osteocyte में हम नहीं कहते it is a correct answer. The reason is that osteocytes means mature osteoblast and it is surrounded by bone and no longer by manufacturing the osteoid. So that is the reason it's not the correct answer. So let's move on. I will show you that location. So before that, let me just come up with this MCQ. Yeah. So when I am talking about this, see here. So the interface between osteocytes and bones are not the correct, because when we are talking or when we are telling osteocytes is included, osteocytes is no longer manufacturing osteoid. So osteoid is no longer manufactured with it. So A is wrong. Interface between osteoprogenitor cell and bone marrow. Actually, osteoprogenitor cell is not similar to osteoblast. It's act as a stem cells. It is acting as a stem cell giving rise to other forms of the cell. So it is not the correct answer. Fibroblast and perosteum is again not the correct answer, because fibroblasts are the cells of the connective tissue and not forming the perosteum or the bone, not included in the bone formation perosteum or not. So only D is the correct answer. So this gives us the correct answer as D. Now let me share this image where I want to show you the exact location of osteoid. So here you can see this is the osteoid matrix, and here the cells can be clearly seen. These are all osteoblast, which is whole surrounded by osteoid, as you can see. So this is osteoblast, as you can see. Then the bone starts. These are whole, the bone part starts, and this is the osteoblast. So you can clearly see, if we talk about osteoid, the location is between the interface of the osteoblast and that of the bone. Okay. So mineralization. Other than that, when you see osteocytes, you can see when it becomes properly mineralized. Okay, when it becomes properly mineralized and mature osteoblasts are called as osteocytes. So exact location of this organic matrix, which is the osteoid unmineralized organic matrix, will be lying in close association with osteoblast and that of the bone. So is it okay, everyone? Can we move on to the next MCQ? Let me know. Have you understood this? Let me know so that we can move on to the next MCQ. Everyone. Okay, can we move on to the next one? That is question number 10th. Is it okay? Yes. So let's move on to the next. That is question number 10th. Okay, dear. A 12-day-old female infant with fever is examined by the pediatric team. Imaging reveals malrotation of small intestine. So malrotation of small intestine is the key feature which is mentioned. Malrotation of small intestine is the key feature which is mentioned. Without fixation of mesentery. Without fixation of mesentery. The vessels around the DG junction is located, and that is at a risk of becoming gangrenous. So according to you, which of the following has occurred to cause the obstruction? So what is the reason of the obstruction? Whether it is diaphragmatic atresia, subhepatic cecum, midgut volvulus, or duplication of the intestine. So according to you, which is the correct answer? Question number 10, mark the correct answer. So take your time and mark the correct answer. Take your time and mark the correct answer. Question number 10th. Okay, so yes, Yes, Prachi. Okay, question number 10th. Anyone wants to give the answer or I come up with the explanation right now? Okay, so the correct answer is C, that is midgut volvulus. Okay, I got an answer from Joseph. Absolutely right. Joseph has given the right answer. It is midgut volvulus. Midgut volvulus is the correct answer. So yes. Now my dear aspirant, let me just show you this options. So why midgut volvulus is the correct answer? This is the correct answer. So when we are talking about midgut volvulus, so it can be the possible complication out of the presentation of the patient which is provided. It can be the possible complication out of this malrotation of the midgut, and actually the reason is the loop which is herniated is not having fixed mesentery. So here one point is malrotation of small intestine without fixation of the mesentery. So the word without fixation of mesentery is the hint which is providing that it's a condition of malrotation of midgut which is not having any fixation to mesentery. So this is the reason the small intestine twist around the vasculature that is providing the support for them. This can lead to ischemia and the necrosis of the loop being involved. So this is the reason it is the correct answer. Is the possible complication of malrotation of midgut. Without fixation of mesentery. So the word without fixation of mesentery, is providing the hint for the right answer. Is the midgut volvulus twist. So the small intestine twist around the vasculature, and this can result, when it is twisting around the vasculature, it can result in the case of necrosis. So this can be the reason which is causing the necrosis. What about the other options? So why other options are wrong? So diaphragmatic hernia is wrong. Why? Because anyway diaphragmatic hernia is not a cause of any kind of volvulus. So it's a wrong option. Duplication of intestine. So again duplication of intestine is the wrong option. D is wrong option. And the reason is duplication of intestine could not cause this condition which is mentioned here, because volvulus is still being fixed to the mesentery, no free movement of the intestine. So duplication of intestine means the duplicate could not cause the condition because there could be still fixation. So here there can be fixation. If the answer is duplication of intestine, there can be fixation of the mesentery. So it will not involve no free movement. No free movement of the intestine. So that these all points support that duplication of intestine is not the correct answer. Now, subhepatic cecum is also not the right answer. Actually, subhepatic cecum is not the right answer, and the reason is that it is due to the subhepatic cecum is due to not formation of cecal valve. So it's the failure, due to failure of cecal bud formation, which results in absence of ascending colon. It is not going to lead to a condition of formation of any malrotation of midgut or causing any kind of loop without having any fixation. So here this is supporting again that subhepatic cecum is not the right answer. Now, so these are the options provided. Other than that, the other reasons which can given as a point for you. Okay, many of the students, all of you have given C as the correct answer. Great one. Actually, other option which can be provided is one is congenital megacolon. Again, congenital megacolon can't be the right answer because we know that congenital megacolon is due to faulty migration of neural crest cells in the wall of the colon, and that will lead to lack of parasympathetic postganglionic neuron. So it will lead to lack of parasympathetic postganglionic neuron. So it is again. So according to this explanation, the most correct option is C. All other options are perfectly wrong. C is the correct answer for this MCQ, question number 10th. Okay everyone, is it okay? Yes. So my dear aspirants, before ending the session, I would like to give you the brief of tomorrow's session and upcoming session. So this was the session. I nearly know that one of the session is left. I told you that today I will take 6 p.m. session, but due to some issues, I was not able to take this session. Don't worry. Again, the day that is Saturday, my dear aspirants, Saturday and Sunday, I will take so many of free special sessions, especially for you. So maybe 5 or 6 sessions I will take. So all of you do present for Saturdays and Sundays session. Okay. So Saturday one of the session at 11 p.m. night is the is the MCQ for INI-CET examination past year. Okay. Previous year MCQs, but I will take many of the sessions on Saturdays and Sunday. Okay, Saturdays and Sunday, more than 6 sessions I will take. So there will be 6 sessions. So do join for me. Do join this session. I will provide the link of the session. Also you can use. Thank you Prachi Roy. So NAT10 is the code which can be used by you if you want to be the present for my session. Also before ending the session, I would like to give you the information. So my dear aspirants, I just want to give you the information regarding tomorrow, that is Friday. So tomorrow is Friday, and what is the plan for the day? So on Friday, that is tomorrow, I am taking 2 p.m. session is the MCQ session of MCQ marathon which I have started. So MCQ sessions of anatomy. So quiz, it will be an anatomy quiz. This quiz will be of 15 MCQs. So all of you join for this session 2 p.m. start. You can fast forward and see the session, because I have because this 2 p.m. session is the recorded version, but I will be there for replying your messages. 6 p.m. session is live. Tomorrow 6 p.m. session is live, where I am going to discuss 50 image based anatomy MCQs. 50 image based anatomy MCQs targeting for INI-CET examination. So all of you please note down, tomorrow 2 important sessions is there. 2 p.m. MCQ marathon anatomy quiz of 15 MCQs. 6 p.m. 50 image based MCQs of anatomy. So do present for this session. This will be highly beneficial for you. So we will solve these MCQs right together. And what I want you to tell before ending the session. So this is the whole schedule of Friday, tomorrow. Thank you dear. And what I want you to tell that before ending the session, thank you, do present for the session tomorrow, and do like, subscribe. And if you are present for special sessions, that is special free session which I am taking on the Saturdays and Sunday, which will be of 6-7 sessions in continuation with a gap of 15-20 minutes. So you can also download the PDF note. What is the positive point about this session? You can download the PDF notes. So download the PDF notes. So PDF notes can also be downloaded by you. This is the positive point of this session. And those who want to take the subscription of Unacademy, how they can do go for subscription? Use the code NAT10, take the subscription, or you can use this code NAT10 for unlock the free sessions on the Unacademy platform. So you can get 10% discount for taking the subscription, and also NAT10 as an unlock code. All the best, keep studying. Thank you so much. Okay, all the best to everyone. Those who have missed out the session can see the session, fast forward it, and you can see the session from very beginning. और कल हम मिल रहे हैं. Tomorrow we are meeting with 2 sessions, 2 p.m. and 6 p.m. So do present live for the 6 p.m. 50 images are there, and 2 p.m. sessions you can fast forward and see the quiz. Attempt for the quiz. All the best. Keep studying. Thank you. Thank you everyone. Thanks for your appreciation. Thanks everyone. Tomorrow 2 p.m. and 6 p.m. session. All the best. Keep studying. Thank you so much. Okay, all the best. Do present live. That gives me a motivation. So do present live. Thank you students. Thank you. Thank you everyone. Thanks.